I think we're going to go ahead and get started. So, hello, everybody. Thank you so much for being here. My name is Savannah. I'm on the marketing team here at Seaview. If you are unfamiliar with us, we are a multi-specialty orthopedic practice, and we've been around for over 40 years taking care of the Jersey Shore. We've grown over the years and currently have 6 locations: Ocean, Freehold, Homedale, Brick, Barnegat, and Monroe, and we will soon be expanding over to East Brunswick. We're super excited to be hosting another edition of our virtual education series. We're thrilled to have Dr. Joseph Gower on today to talk to us about avoiding common summer hand injuries. So for those who don't know, we do these virtual education seminars every other month with different doctors about different topics. Information on that can be found on our website under the About tab or in the news on our homepage. And you can also stay up to date with all things Seaview by following us on our social platforms. We are at Seaview Ortho on Instagram, TikTok, LinkedIn, and Pinterest. We also have a bi-weekly newsletter that you can subscribe to on our website. And in addition to that, we have a podcast called the Seaview Ortho Podcast, where we cover all things ortho. And you can head over to your favorite podcast listening platform and give it a listen. So before we jump into the presentation, just a couple ground rules. I do ask that everybody remains muted during the presentation. So if everybody could go ahead right now and make sure that their microphone is off, we want to make sure everyone can hear Dr. Gower. And additionally, please write down any questions that you have, and we're going to save them for the end. So once Dr. Gower does his presentation, we'll open up the floor to a Q&A. You can either unmute then, or you can type it in the chat on the bottom right-hand corner of your screen, and I will read it aloud for you. With that being said, this presentation is being recorded. It's going to be sent to your emails afterwards. So if somebody you know couldn't make it, please feel free to share the link. And with that in mind, we just ask that you please refrain from sharing any personal medical information in your questions. So please try to keep your questions as generic as possible to avoid putting your healthcare information out there. And if you have any more specific concerns that are pretty personal, Dr. Gower is seeing patients in Barnegat, Homedale, and Monroe, I believe. So feel free to book an appointment. And now I will introduce our guest of honor. Dr. Joseph Gower is a board-certified orthopedic surgeon specializing in hand, wrist, elbow, and upper extremity care. A graduate of the U.S. Air Force Academy and Georgetown University School of Medicine, he completed his residency at Monmouth Medical Center and a fellowship in hand surgery at NYU Hospital for Joint Diseases. A proud U.S. Air Force veteran, Dr. Gower served in Iraq and Afghanistan, held leadership roles in military medical centers, and was an orthopedic consultant to the Air Force Surgeon General. Known for tailoring care to each patient, he is skilled in both surgical and non-surgical treatments to help patients maximize their healing potential. So without further ado, Dr. Gower, are you ready?
I am, so much.
Perfect.
Thank you for that wonderful invitation. Hi, guys. I see definitely some recognizable faces and names out there. Good to see you all. As Savannah said, I also go to Brick, and the only office I don't go to is Ocean office. I go to Freehold office as well. But it's really nice to have you guys here and spread the word. If anybody has any hand issues, have them come see us. We got a really good team. Besides me, we have Monica Debkowska, Art Vason, and Kevin McDade, all board certified hand surgeons, all fantastic practitioners. And some of them go to offices I don't go to, different days that work out better. And feel free to see them at any time too. So let's get this thing rolling here. All right. So in the summer, I like to think of, summer injuries can be a lot of things, but 90% of my day is common injuries that aggravates conditions that people have had beforehand. All right. At the end of this talk, if anybody can tell me who that is in that picture, I'll buy you an ice cream at Dairy Queen or Sundays. So one of the most common things that I see in the office is aggravation of arthritis. Now, most people by about their mid-30s, maybe a little later, start developing arthritis, and they first notice it usually in these joints right across here in the fingers when they go to the grip. What's interesting is as we age, these digits right at the end, or the joints right at the end, become knobby, but really not too painful. The most painful arthritis that people come to me for is arthritis at the base of the thumb. And I guarantee you that 50% of people listening right here have pain at the base of their thumb. That's called basal joint arthritis or thumb CMC joint arthritis. And that's right here at the base of the thumb. If you turn your hand around, people feel it in their palm sometimes, and they feel it when they push down on it or when they pinch. The force of a pinch is actually designed to get absorbed right at that joint. And so that joint bears the brunt of all your gripping through a lifetime. Incidentally, it's more commonly painful on the non-dominant hand. I use the analogy of sawing a piece of wood. Now, you don't have to saw a piece of wood for a living to understand the analogy, but if you had a brand new saw, you'd be cutting with your dominant hand. For me, it's my right hand. But if the saw is sharp, it should be cutting through wood no problem. But that left hand for your whole life has been your gripper. And like I said, that absorbs all that force, and that's where people tend to get pain. So, of all the arthritis, I had a full day of office hours today. I probably saw about 10 people with base of the thumb arthritis. Now, how we treat this, usually, if you come in the office, I'm going to tell you to get a good brace. We do have braces in the office. This is a brace. The picture right here is the one I like the best. It's a flexible brace. There's nothing rigid in there, so you can do everything you like to do in the summer. You can garden, you can cook, you can play pickleball, racquetball, tennis, golf, whatever. It'll change your grip a little bit, but these straps on here will help stabilize that because your pain is coming from that thumb grinding at the joint. That's where you're getting that pain. There are always therapeutic exercises. When people say, "Oh, I've got hip arthritis and knee arthritis," and you get a prescription for therapy, you take it and it just makes sense. Well, there's therapy for the hand too, and there's tons of muscles around the hand that can stabilize that joint so that hopefully it doesn't grind as much and be as painful. All right. Now you can find them online. You can go to YouTube and find almost anything. You can definitely find a lot of hand therapy on YouTube, or you could go to our fabulous therapists we have here or throughout Monmouth and Ocean County. I know almost all the hand therapists. Most of them have me on speed dial, so even if you go out of practice, they can get a hold of me. In the office, you can get injections for arthritis. It's not my first go-to. I like people to try and brace it, stretch it out, try to modify their activities, but it's an option. And of course, there's always surgery, but let's not talk about that right now. Let's talk about avoiding surgery for the summer here. The other thing that people feel in the summer, and it's usually one of the bigger problems, and if you add arthritis to this subject, tendonitis, you've taken up 90% of my day. The other 10% are trauma, maybe 80-20. But tendonitis can happen from the fingers themselves, all the way down into the forearm and the elbow. And every one of those areas you get tendonitis is just as painful as the other. And when you get it, you'll know it. I threw trigger finger in there. It's technically not a tendonitis. It's called a tenosynovitis. A trigger finger is when you start developing a mismatch of the tendon size and the sheath of the tendon that bends your fingers right about this level or this level in your thumb. And the tendon that bends your fingers and thumbs gets stuck and your finger goes clunk and you have to open it back up. And a lot of people experience this in life for a small little bit, for a week or two, and don't think much of it. But there's a good portion of people out there where it goes down and they have to pull it back up and it just never goes away. It lingers there for 3-4 weeks. That's a trigger finger. And if you have that, you come on in. It's one of the few things in medicine, especially in orthopedics, that gets treated well with an injection. Most of the time, injections are for pain relief only. If you get a shoulder injection, knee injection, even injection in your wrist joint itself, that's treating pain. It is treating inflammation, but it's not healing a meniscus or it's not healing a rotator cuff tear. There's nothing wrong with that. Sometimes you need to get an injection to help you do your therapeutic exercise and get your work done. But for trigger fingers, 65% of people to 70% of people with 1 to 2 injections for a trigger finger, and this is a steroid injection, have resolution of their symptoms. Those are decent odds. And so it's worth it if you want some intervention for that. When you go on down the list on this slide, you'll see some fancy names like the Quervain's tendonitis, ECU tendonitis, flexor tendonitis, extensor tendonitis. Those are all tendonitis that can happen around the wrist. And they're all kind of unique in certain areas. The de Quervain's tendonitis can happen in the summer from weeding a lot, pulling, gripping, twisting. They call it mommy's wrist because your wrists are going like this to pick up newborns, new pets that you're lifting up. That's where people get an aggravation in their extensor tendons on what we call the radial or thumb side of the wrist. Sometimes people get tendonitis of the ECU tendon, which is on this part of the wrist. We call this the ulnar side of the wrist. That's typically more in rackets, sports, golf, pickleball, that kind of stuff. You can have it traumatically. Sometimes people, if they're using a torque wrench or something like that, and it moves while they're gripping it, they'll have an injury on this side that'll twist. And everybody who breaks their wrist ends up having pain on this side of the wrist for a good portion of time, 6 to 9 months, sometimes a year. And that's largely because of the tendons and some of the ligaments that get irritated over in here. The more common one you may hear of is what we call tennis elbow, which is when people, I'm trying to point to the outside of my elbow, people have pain right here. Almost everybody in their lifetime experiences tennis elbow or lateral epicondylitis. It runs its course, and most people in 6 to 9 months. Sometimes it lingers a little longer, but it is exquisitely painful. I call it the plantar fasciitis, and if you've ever had that, you know what I'm talking about. The plantar fasciitis of the elbow, and it can make you downright miserable. But there are ways around that. There are braces you can wear. There's stretching exercises, formal, informal therapy, potentially an injection. Once again, for pain relief only. It's not going to cure anything. Remember, the trigger fingers are your only golden ticket when it comes to injections, and very rarely surgery. All right. So let's get into some nitty gritty of some summer activities. All right. So first one's grilling, cooking, etc. Now, cuts, clearly I said about 80% of my day is trauma. There's probably one person per week who has a cut in my office from an avocado, a bagel, or sometimes just really fast chopping vegetables. All right. And most of the time, they get away with a benign cut. People have a lot of sharp knives these days. They're easy to buy a brand new knife set at Costco or Sam's Club, and they're darn sharp. All right. And they'll get you. But you got to be super careful, because if you have a cut in this part of your hand, we call these the flexor tendons. But if you have a cut from a knife that goes across here, that surgery is very complex, and it's very hard to restore normal flexion. All right. We take it for granted in a lifetime that the function of these tendons is always going to happen just like this. And sometimes a good recovery after a laceration to one of these tendons is a finger that goes like this. Now, we don't do a lot of things with a closed fist, but you do a lot of fine manipulation, and you'll notice that if you have a cut in here, they used to call that, in the early days of hand surgery, they used to call that no man's land, because there was no surgery that could help you. Now there are surgeries, but they are very complex. If you ever have a cut, this is my general rule. If you have a cut in your hand, whether it's here, down here, on your thumb, or the back of your hand, and you can't straighten out your fingers or you can't flex your fingers, you need to get looked at. All right. Now, it may be pain. That's fine. That's for us to determine. All right. And the main reason is because these issues, even if they're non painful, but it's just not bending, the surgery that you may need to have for a flexor tendon laceration or an extensor tendon laceration is a lot easier to do within a week or two. All right. So you get that surgery done within 2 weeks, a lot less scarring, a lot better chance of hopefully getting close to normal. In this kind of neck of the woods, 80% of normal is probably an excellent recovery. So you delay that time even more, and then you're kind of putting yourself in trouble with that. All right. Now, sometimes there are some protective things. I hadn't seen these. This is the benefit of therapists. The therapists are really good at educating our patients on how to protect yourself. Here's a knife guard while cutting. I suspect most people have shaved off some skin from the back of their fingers from cutting, or you try to curl in. I should probably get one of these. I'm not the most patient person. This right here, these are interesting. These are gloves that are protectant. They give you protection from knives. I found this when I was stationed in San Antonio. I got hooked into smoking briskets, if you could believe this. And if you've ever cut a big raw brisket, it's impossible. And if you have a sharp knife and you're cutting through a really tough brisket, the reason why briskets have to be smoked for 14 to 16 hours is because they're a solid pec muscle of cattle. And when you're cutting that, let me tell you, you hit a rough spot and that knife's going to go flying. And I've had some near misses on these, and it's usually at 2 in the morning because you got to start that smoking nice and early. But this is a nice thing to protect you if you're looking for something. This is always interesting. I tell some of my folks who have a really badly injured hand or really badly arthritic hand and they just can't grip it. You know, with our beautiful structure of our hands, we take it for granted that we can grab a piece of toast and hold it and butter it with another knife. But if your hand can't pinch down on something, then you're out of luck and it makes it much harder. Here you can corner that into the that section of that cutting board and it helps out a little bit. And on the other side of that cutting board, those are spikes and you can put your meat on those spikes and then cut your individual spikes when you don't have your other hand to help you out as well. Just some assistive tools. Now, like I was telling you before, that thumb arthritis will get you, but so will the finger arthritis when you're trying to use tools in the kitchen. And most of the time, it's because the handles are just too small. All right. There are some adaptive tools. There's plenty of websites. If you Google adaptive kitchenware or adaptive knives, adaptive forks, you'd be amazed at what comes up. And there are some fabulous websites out there where you can order stuff right off of there. In this picture here, you see a rocker type knife. So instead of having to push down and hold it, you can just use one simple rocking maneuver with a lot less grip on there to cut your vegetables. All right. Now, like anything, when you have tendonitis, anything like that, you should, pregame a little bit. You probably don't think about it as much when you're making a small meal, but if you're making a bigger meal, or if you're having a Sunday dinner, or you're having a big barbecue, you got to warm up beforehand. All right. Hands love heat, wrists love heat, elbows love heat. All right. Various ways you can literally put your hands in mittens for 10, 15 minutes and that'll heat them up. For some of my patients with really bad rheumatoid arthritis or really bad osteoarthritis, I have them sleep with mittens on and they wake up and their hands aren't as cold. Because even in the summer, if you keep your house at 70 degrees or cooler, that's a chill sometimes for some people, maybe even a little bit more, depending on how easily you get chilled. And if your hands are exposed out of that cover, you're going to have cold hands in the morning. And cold hands are always stiff. So just remember, right before you're going to do anything, a good old warm up, just like in sports. All right. Now, afterwards, ice has its benefits, but really not too much when you're just doing a little bit of work. You can just go back to the warmth and it'll help you out. You even have some patients who their arthritis is bad enough that they get a paraffin wax heater for home. And you can buy them online. Some folks with really bad osteoarthritis will dip their hands in a paraffin wax heater on a daily basis just to get some relief. Right? Now, this is another little thing. This is an under-counter gripper. There are a lot of handheld ones you can see. I actually have one. My wife's starting to get that arthritis at the base of her thumb, and it's maybe about this big or so, that hole right here, and it goes on water bottles. Because water bottles will get you. Even a regular bottle is hard when you don't have arthritis. But when you start developing thumb arthritis or you got a tendonitis, good luck with that water bottle. Some guys will just get their adjustable pliers and turn it, but they have really nice adaptable equipment, once again, that you can use for that. Now, grilling. The main reason I put grilling on here is because of burns. And hopefully nobody listening to this has had a horrible burn before, but you surely have known somebody who does. And these can be some of the worst things that can happen to you. And with grills, you got to be really, really careful. The biggest thing I tell people, whether you're grilling gas or you're grilling charcoal or fire like I do when I'm smoking, You just got to be really careful with handles, lids, anything like that. Just last week, I was grilling on, oh gosh, was it Saturday? I think it was a really hot day. And my grill's outside, totally exposed in the sun. And I think the grill was about up to 550 degrees. And that handle, I had to use an oven mitt just to lift up the handle. Little things like that'll get you. And gripping a handle for long enough, you'll have some superficial burns on your hands, no doubt about it. All right. One thing you can do is get a pair of welder's gloves, and the hardware stores and stuff that sells the grill equipment, they'll try and sell you some fancier stuff, probably $30, more than you could if you just got a cheapo pair of welder's gloves. But they cover all the way up your forearm, and they're protectant when you're reaching in, especially if you're moving around. Some of the bigger, if you got a rack of ribs and you're lifting in there, or for me, when I'm cooking my brisket, I got to get in that smoker and turn it around. They'll help you out a little bit. You got to keep your grill cleaned. If you have a flare out or a grease fire, you're in trouble, and good luck getting that out, because water is not the thing. You need a fire extinguisher, or preferably a fire blanket to help you out with that, or just let it burn out if you can turn the propane off beforehand. Um, I try to clean my grill every 3 weeks. I don't know why, because why I hung on 3 weeks, but I've had a couple grill fires. I almost torched my house on Eglin Air Force Base in 2005, from a grill, because my grill is pushed right up against our little 1,100 square foot house. So I'm a little bit more sensitive to it than maybe some others. All right, here are those welder's gloves I was talking about. All right, gardening. This has to be gardening, yard work has to be the number one reason why people end up coming into my office with overuse. We're blessed with a really good area for gardening from the early days of spring all the way to the fall, and sometimes into the early winter. Um, and this is where it'll get you. And you know what gets you the most with gardening is it sneaks up on you. If the weather's not bad, you think, oh, I'm out there. The next thing you know, an hour passes by, 2 hours pass by, 3 hours pass by. And then in a day or two, your wrist starts to swell up, or you start getting some tingling in your fingers, or your thumb really starts aching. This is a volume dependent profession here, gardening. If you do a lot of it, you got to go about it the right way, because you're going to get some hand issues. And I see a lot of people who develop that tendonitis I was telling you about. You can get a tendonitis right down here in the middle of your wrist. It's where the tendons that bend your fingers come through your carpal tunnel into your forearm. And when they get swollen, they dive into that carpal tunnel. The only other thing that's in that carpal tunnel is your what's called your median nerve. And then you start getting tingling into these three fingers, sometimes a little bit of your ring finger. But that's carpal tunnel, and it can be induced by swelling of those tendons. That's not a bad carpal tunnel to have if you've never had it before, because hopefully if you rest it, wear a splint, let it cool down, modify your activities, maybe change the amount of volume you're doing out in the garden, that could cool down that nerve so it goes kind of back into a little bit more dormant state. All right, let's see here. Now, the one thing that you got to watch out for, and this is why I wanted to dive into this a little, is there are some situations when you're gardening where you may initially think, oh, it's nothing too much. I just got a little scrape on my rose bush, or I just had a little bit of, this needle get into me, or something like that. Probably about 10 of my surgeries in the summer when I'm on call are from some sort of infection that people got while they were gardening, or got scrapes out in the woods. All right. There's some really, really wacky bugs that hang out on plants, or even plants that'll break off in your hand. Cactus plants, agave plants, rose thorns. And sometimes what happens with these plants is if you get a foreign body, I'll give you the best example is the agave plant. I saw this more when I was in San Antonio, Texas, of course, but some people are starting to plant them as they get kind of into the more earthy plants. But they have a toxin on the spines on the agave plant, and if they're buried underneath your skin, it will pulsate and cause you extreme pain until you take it out. I've seen many a tough guy get broken down to their knees from a needle from an agave plant in their hand. Rose thorns can cause a weird fungal infection. And so a lot of times if I see somebody had a rose thorn infection, it's rarely a one-time visit. You know, if it's even a little bit red, I'll watch them in a week or two and see if they're developing something. And sometimes I even have to send folks to an infectious disease doctor to get put on a specific regimen to treat some of these infections. My other rule of thumb, besides if it ain't moving, come see me, is if you had a cut and everything's moving, you have no numbness, and you wash it out, and within 2 days, if that thing's starting getting red around the periphery of the cut, or you starting getting red up into your hand, just come see somebody. Go to urgent care, go to the emergency room. If you can get into my office at a fairly rapid time, or our Seaview at night where you can go after hours and have somebody take a peek at it, because the infections in the hand can be very unique. At the tip, the fingertip will actually sequester off an infection to the point where so much pressure builds up when the infection's multiplying, it has nowhere to go, and it'll eventually poke right out of your finger, and it can kill a part of skin in your finger. It can be very destructive. It's called a felon. All right. Sometimes the infection can go down the sheath of the tendon because the sheath has a very bad blood supply. And even if you get put on oral antibiotics, if something got into that sheath, usually from a deep cut or a puncture wound, that infection can go all the way into the palm of the hand and sometimes even up into the forearm. All right. So a lot of things you got to watch out for. Topical stuff, rashes from poison ivy, from fertilizer, from some of the stuff they used to spray your grass. Clearly you should get that looked at as soon as possible. Let's see here. Now, sports. The biggest thing, I won't get too specific in this sports. The biggest things that bring people to my office are usually overuse, or what I call the 0 to 60 phenomena. The 0 to 60 is not doing something all winter, and then first thing in the spring, going on a 4-day golfing trip with the buddies and golfing 36 holes a day every day after taking just a couple swings. You're going to pay the price after that. And when you have that pre-existing arthritis, tendonitis, you're going to doubly pay the price. All right. So you have to prepare yourself. You have to prepare yourself on a daily basis and ahead of time, months ahead of time, to really get ready to do these things. I think most people, and I know it's a hand talk, but most people should be on some sort of core strengthening program when they probably get into their working days. I hate to put an age to it, but the problem is in the United States is once people start working, probably 80% of jobs are sedentary and people are sitting 8 hours a day. So it doesn't matter if you're 20 or if you're 80. If you're sitting all day, your core is not what it should be. And so you should get on some regular core strengthening program. Now, some people like yoga, some people like Pilates, some people like Tai Chi, some people just like pure core strengthening. I don't care what it is, but you have to make it enjoyable so you can make it replicatable and do it every day. All right. Now, for people who do sports and they have tennis elbow or golfer's elbow, which is pain on the inside. Remember, tennis elbow is on the outside. Golfer's elbow can be on the inside. There are specific braces that people can wear for each of these, and I have some examples of some. And they're no different than when people wear a knee brace or an ankle brace for either stability or comfort. All right. Let's see here. This is your classic tennis elbow brace. And this big blue pad that you see in there, that goes right over the musculature of the tendons that are pulling off the outside of your elbow right there. The muscles that are in here all combine into a common tendon. The tendon is where you're having pain. But when you put this brace right over about here, just like you see on the picture, when you lift up your wrist, this pressure here dissipates some of the force from the outside of your elbow. That's all it's doing. It's nothing magical. There's nothing. They could tell you it's made out of copper, platinum, whatever it is. It's nothing that has to do with that. It has to do with just offloading it a little bit. You can use it for golfer's elbow by just switching that pad into the muscles on the inside of your elbow. Now, The only difference on the inside of your elbow that you got to be careful is there is a nerve, that funny bone nerve. That funny bone nerve is called your ulnar nerve, and of course, it's right underneath here, very superficial. If you occasionally have tingling into your small and ring finger, that's cubital tunnel syndrome, where your ulnar nerve is under pressure in your elbow. If you have tingling in your small finger, you may want to avoid one of these straps, because when you put pressure on there, it squeezes a nerve that already has a little bit of problems in it, and it may kind of accentuate your symptoms a little bit. Here's just a common elbow compression sleeve. If any of you have seen me in the office and you have an elbow issue, I usually end up recommending a simple elbow compression sleeve. Doesn't have to be tight, but it has to be just gentle enough that if you do have some swelling in your elbow, it can contain that. It gives you warmth to your elbow. And there's something that we call proprioception, which is basically the elbow and the brain working together when there's gentle compression, and the brain tells the elbow and the elbow tells the brain that everything's okay. So it's just one of those things that add some comfort, but probably not a bad idea if you have elbow pain. Interestingly enough, elbow arthritis is relatively uncommon. There are three types of patients that I see elbow arthritis on, because we talked about a lot of hand arthritis. Elbow arthritis happens largely in people with rheumatoid arthritis, trauma to the elbow in the past, and most people, it has to be enough trauma where they remember it. They dislocated their elbow in high school wrestling. They broke their elbow, playing pickleball or something like that. And the third person is guys my age in their 50s with arms the size of my thighs. Guys that are still in the gym trying to push up metal that shouldn't be pushed up at that age tend to wear out their elbows a little bit. This here is a arthritis compression glove picture. I found these to be the most helpful for folks who have arthritis from the thumb all the way to the last joint right here. Now, this joint right here, it's almost impossible to cover with some sort of glove. And so you can buy online, they're called finger compression sleeves. If you go to Amazon and put in their finger compression sleeves, they'll go from about here to here, and you have to buy a pack of 30 because you're never going to find one size that fits. They give you a pack of 30 that has a bunch of different sizes, and it'll apply some compression over that joint. The gloves kind of conquer all the other joints in one fell swoop with some gentle compression, keeping that hand warm and adding a little padding onto the hand when you go to grab items. Lastly, I think that now I have fireworks at the end, but that'll be quick. So the one thing about water activities in the summer I'll tell you about is in places that are, or excuse me, in coastal climates, coastal habitats, you'll see some of the nastiest infections that you'll ever see in your life from the water. Now, it could be something as simple as a barnacle scrape if you hit the dock the wrong way, or a pre-existing cut. Could have been a shaving cut earlier that day. If you have an open wound, you should not be swimming in anything, and that includes chlorinated water, because chlorinated water is still dirty. I don't care what you're saying. It's still going to contaminate. But you go swimming in the bay, the ocean, a stream, a river, you're tempting fate, because some of these water infections can be really miserable. We usually see them in the fishing side of life. A lot of guys get impaled by fish hooks or fish themselves, scales. I had a guy the other day who got cut by a skate tail. When I was down in Florida, every once in a while somebody would accidentally step on a stingray and get a stingray barb. And so besides getting an infection from an open wound, you can also get a retained foreign body, and it can act just like those plants. If you have a stingray barb, usually people would have them in their feet, but sometimes have them in their hand. You are more than miserable until that thing's out of your body, because it emits a toxin that is super painful. All right. Unfortunately, with some of my fishing crew, some of these guys get hooked or get cut 100 miles off the shore, and I don't see them for 2 or 3 days later. And so some of these infections can really get out of hand. But most of the veterans out there know that the first thing to do is really wash it up, cover it up, and try not to get it dirty again. Let's see here. Lastly, now this one's mostly intuitive, so I'll leave most of the stories I have from fireworks to your imagination because they're all horrible. It's the closest. I always tell people this is the closest you'll get to combat injuries, and I saw a lot of combat injuries in the civilian world. People say, "Oh, high speed trauma from a car accident." Not even close. But fireworks, very close. All right, because some of these fireworks are basically, you know, almost like having a hand grenade blow up 20 feet from you. It's the same velocity. It's just instead of metal, it's just that burning pressure going right through. And you can see some real bad hand injuries all through the year, not just 4th of July. It's really on the shore. It's all summer long because you hear people shooting off fireworks almost every night if you live within a mile or two of the water. Um, Simple things, sparklers can cause some nasty burns, especially some of these super sparklers. So really be, supervising the kiddos if you're going to let them do that. The fireworks that are in the brown paper, we used to call them the quarter sticks when I was a kid and stuff like that. Those are no good. Those are for the pros, all right? And you don't know where they came from, and they will do some destruction. All right. And the old notion of a bottle rocket, you really shouldn't try to shoot anything from any of those unless you're a professional because exploded glass will get you just as fast as anything else. So I think in summary, I yapped enough. Hopefully that answered some of your questions. But really, when you have anything, if you ever want to see any one of us, the easiest way, is to try online, give our office a call. We do have the Seaview After Dark. But if you have an urgent hand issue, go to the emergency room. For us, we cover hand call at Ocean Medical Center in Monmouth. We also go to Jersey Shore, but we're not on the hand call at Jersey Shore. Ocean Medical Center is easy for the southern crew. Monmouth is easy for my northern crew. But if you go to one of those and you request us, if I'm in the area, I'll certainly be available. Anybody have any takers on the baseball player from the first picture? No?
We'll see if anybody types in the chat.
Okay.
That was
All right.
amazing. I did not know that you are a grilling, gardening, fishing extraordinaire over here.
I'm
That's
not a
great.
fishing extraordinaire, but I do love the smoking. That's probably the best thing I learned from Texas was Texas barbecue.
That's amazing.
Huh.
All right,
I'm
so
not
we'll
sure
open.
how to chat. How do I type in a chat?
So in the bottom right corner of your screen, there should be a little chat bubble. If not, you can just speak it out loud.
Is that Jackson? Somebody Jackson? The baseball player?
Oh no, it's not. That's a good
How
call.
about Munson?
Did you mean who said that?
Maria, I said Munson.
You nailed it. Thurman Munson, my favorite ball player of all time. Yes.
Thurman, I
My dad
couldn't-
would have known that.
New York Yankee, right? New
Yeah.
York Yankee?
Yeah, he
Yeah.
was the New York catcher from good probably most of the 70s. Had a very untimely death, I think, in 1980, somewhere around there. I was pretty young, and is still not in the Hall of Fame, but deserves to be.
I had two brothers. One was a Met fan, one was a Yankee fan. And
Yeah.
I don't know, I just remember some of their names. So I just
Yes.
took, and I think I may have remembered his mustache. Maybe that's
Yes,
what
that
did
he had a very distinctive mustache, and this was in the pre-Steinbrenner mustache ban. So he was one of the
Oh,
last
yes.
holdouts.
Yes. Well, that was more recent, though, I think.
Correct. Yeah,
Yeah.
that was more in the 90s. Yeah.
Okay. All
I
right,
love
Yes,
it.
good.
Go
Good.
Yanks. All right. So again, if you have any questions, please feel free to type in the chat. Feel free to unmute. We'll wait a
Can
couple
I-
seconds just in
can
case
I ask?
anybody's typing.
Yeah.
Absolutely.
I just have to say, first of all, my nephew is about to be a junior in the Air Force Academy. So
Hey, all right. Fantastic.
So go Air Force. Really
Yeah,
excited
you got
about
to go
that.
out there for
Yeah.
the graduation. That's what that is in that picture there. You need to be there.
Oh.
Yeah, we watched the one from last year online, and it was spectacular. So
Yes.
I'm looking forward to that.
A little side note, I don't mean to take up your time, but interestingly enough, when I graduated from the academy, the Thunderbirds missed our stadium. They flew over a half a mile south of the stadium. And it's an interesting thing. It was a really low overcast day. And I don't think we really have an answer as to why that is. They still came by and did a great show. It was awesome. But we all threw our hats up. They all came crashing down. And on the south side of the stadium, you see these 6 F-16s go burning past. Like,
Oh
well,
no.
okay.
Oh man.
Anyway, yes, ma'am.
Oh, so the only other thing I was going to ask is I've turned into this avid gardener that I never
Yeah.
knew was in me. And so, yeah, trigger finger is something new.
Yeah.
And so, do you have any further quick ideas or anything ergonomic like I just love pulling all those weeds out
Yeah.
and you're right, hours pass. So is there anything that you can recommend to
Well,
assist in that?
for sure, when you're pulling weeds, you got to take breaks for sure. I don't see the trigger finger. I don't see as much with the weeds. I see a lot of tendonitis in here. Some people, after really gripping all day long, get a wicked swelling. Now, that can go down your hand. And I didn't touch on too much, but some people are just more likely to develop trigger fingers, and that's probably you. They're just more like, I have a trigger finger that rears its ugly head every fall when I have to stack my firewood. I guess I don't do anything too physical the rest of the year because I never have it until I stack my firewood. And I get this click for about 2 weeks and it just goes click, click, click. And then it finally goes away. The one thing you can do if you're starting to develop a trigger finger, you can wear a splint at night if you want. You can buy off the shelf splints, or you can wrap either tape or a band-aid right around this joint to try and prevent it from flexing at night. Because at night, no matter who you are, you do this. We all do it. We curl up and we squeeze our fingers down. And when your finger's swollen or starting to get swollen, and you're more likely to develop those triggers, you're going to put pressure on that all night long. It has no chance to rest. And so if you put a splint on there and you prevent it from flexing down, you'll give it the rest that it needs. Because you don't want to, I always tell people, if you expect to hear from me, do less of something, I'm rarely going to say that because that's not very orthopedic. We don't like that. We want people to do what they want to do. But you got to do it smartly. So you take breaks, you do this. They do have some things, I'll be honest with you. I kill more weeds with vinegar type stuff these days because they're a lot easier to pull out when they're dead. And so if you have the patience and you kill your weeds, I'm not, take your choice, but I tell you what, these vinegar mixes work better than almost anything. They're easiest to make. They smell awful. Your garage will smell like a French fry, but they work. And it's a lot easier to take care of those weeds 2 or 3 days later when everything dies. Yeah.
Great. Thank you so much.
Yes, ma'am.
Thank you. Really appreciate it.
Go to that graduation.
Oh yeah. Go Air Force. Woo!
There you go.
Hi, doctor. My name's Philippa. So sorry for being late.
Hi.
So I have a background. 30 years ago, I had a car accident. I
Oh,
have fusion, that
yeah,
affected. I had lost the use of my hand, etc.
yeah,
And the fact that I have been playing piano. I'm a retired music teacher, but I've
uh,
been playing the piano now for 62 years.
wow.
So I'm fine the past 9 years when I retired 9 years ago.
Yeah,
So I'm only able maybe to play for 12 minutes, some days 15,
yeah,
but
yeah,
I'm um but I find also because of my past job, but more because of the accident, just filing papers. If I file papers two
yeah,
hours, you have these house things you want to shred
yeah,
papers and this and that.
yeah,
So, can you give me any um advice? I'm thinking with piano, seeing those gloves,
yeah.
maybe if I wear some kind of supportive gloves, that would
Oh,
help
for
me.
sure.
Tell
Yeah.
me what you think.
Well, I think, the nice thing about those the arthritis compression gloves is if you look online, oh my gosh, you'll find more than you can shake a stick at. Some of
Okay.
them, some of them stop here and leave these two joints, which is one's called your PIP joint, your DIP joint. Some of them
Uh-huh.
stop here and leave your fingers more flexible. And if you need more flexibility, because sometimes, and this
Yeah.
may be the case with your injury, sometimes you just don't have that motion. And if you put a glove that's too constrictive on, you lose a little bit more of that motion. So sometimes you just use a shorter compression glove that at least gets this joint, gets your wrist, gets the base of your thumb, heats it up so you can do your thing. So that's number
Yeah.
one.
Okay.
I touched on the paraffin wax heater. My only warning with that is if you have any bad nerve damage from your accident and you can't feel temperatures well, that's probably not
Yeah,
your best coat.
this is
Yeah,
still 60% not like there, you
yeah,
know?
yeah,
Yeah.
yeah. And you have to be really careful with temperature issues. In fact, the most common cause of poor sensation in the fingertips is probably diabetic neuropathy, right? That tons of
Yeah.
people,
Y-
the end stage of
Yeah, this is
diabetes,
this
it's a
was this yeah, like this was from the accident, because my
yeah,
I had two herniations that were just powder from the accident when they hit
yeah,
me. So it's like bone on bone. So
yeah.
fortunately, I like can bend it. Fortunately, I can play the piano,
Good.
but it's a slower finger,
Yeah.
but
I,
it's still better than like not like having anything at all.
100%. And playing piano is
Yeah.
very intricate skill. I would also say, for you, if you have that kind of lifetime skill and that kind of, ability, that's a pretty serious one. I would strongly consider going to see a really good hand therapist and working with them and working it out because that's something you want to preserve as much as possible.
Yeah. Uh-huh.
Yeah.
Yeah. Thank
Good,
you. Thank you
good
so
luck to you.
much.
Yes, ma'am.
Thank you.
All right. So I see two questions in the chat. The
Oh,
first one says Voltaren cream. Can it be used every day for long term?
well, that's a great question. So the Voltaren cream, the short answer is yes, but the long answer is it depends. All right. I'm going to tell you that the patients that I have that some of their cardiologists, primary docs, internists have a problem with them using Voltaren are the ones that are on blood thinners, specifically these newer ones. I call them new, but they've probably been out 10 plus years. Eliquis, Brilinta, those kind of things. When you're on those to take, Voltaren, when I first started in practice, Voltaren was the tablet. All right. But it was a crappy tablet and people got really bad gastritis from it and stuff like that. So they kind of took it off the market and they make this Voltaren cream. And the Voltaren cream is perfect. It really helps with hand issues because the bones are so close to the skin that when it gets absorbed in a subcutaneous way, it just helps more. If you think putting Voltaren gel on your hip is going to go deep into your groin to help your hip, I don't know. I'm not sold on that one. But you put it on your hands and it's going to work. But when you're using Voltaren, you should really be cognizant of the dosing. So read the labels. They give you a little meter that you measure out how much you use, and you really shouldn't go over that because your skin is an organ and you're absorbing a non-steroidal anti-inflammatory, which is the same as taking a tablet by mouth. All right. So you have to adhere to the dosage so you don't take too much. So those are the two things. You got to watch the dosage. And if you're on those blood thinners, you got to watch out too.
Awesome. So one other question in the chat, is there a particular brand of hand braces or compression gloves for thumb arthritis that you recommend?
There is. Yes. So I tell you, if you can write this down, if you have a pen and paper, for the base of the thumb, the brand of braces called the Comfort Cool Thumb CMC Restriction Splint. So once again, Comfort Cool Thumb CMC Restriction Splint. If you put that in Amazon, it's going to come up as a Comfort Cool Splint. And I promise you, we have online, web forums that hand surgeons talk on and stuff. And this always comes up as probably one of the better tolerated brace out there. Another brace out there is called the Velpo, VELPEAU, Velpo brace. And some people like that. I just had a patient today who told me she didn't like the Comfort Cool, and it's probably the first time I've heard that in months. Most people like that. That first picture I had of the thumb brace, that's the closest you're going to get to a Comfort Cool. I didn't want to put a proprietary thing on the slides, But that's the Comfort Cool brace, which is all soft, no metal in it. When you have metal in the thumb brace, you make yourself into a non-opposable hand, and that doesn't work. When you have a flexible brace that has the straps that stabilize it, you can still bring your thumb at least enough over where you can pinch, grip, and move your thumb. But if it's rigid, it'll help it feel better. You just won't have any function to it.
I just typed both of those in the chat for anyone
Yes.
who's looking there in case you missed
That's
it.
perfect. Yeah, that's
So
perfect. And
I
yes, ma'am.
I think we have time for one more question. If anybody
All right.
else has one more. Any takers? This was a great one. I learned so much that I didn't know. And it was so nice to see everybody's faces. Usually we don't see anybody on these things. This was great.
Yeah. Thank you
Any-
very much, everybody. And come see me in the office. I'm everywhere except the ocean office. And we got 3 other hand surgeons in the practice. They'd be happy to see you.
Yeah.
And a special thanks to Savannah and our marketing crew. This none of this would be possible without their efforts. So great job.
Thank you. I'm gonna do my last spiel one last time, just in case anybody missed it. But we do these seminars every other month, different physicians, different topics. So if you subscribe to our email newsletter or stay up to date on our website and socials, you can check that out and be up to date. We're on all social media at Seaview Ortho. And again, Dr. Gower is accepting new patients. You can book online at www.cviewortho.com. Or you can call us at 732-660-6200. Again, this presentation was recorded. I will send it to your emails. If you want to rewatch or you want to send to somebody, it'll also go up on our website. So I just want to say thank you to everyone for joining us at the 6 p.m. little time slot to learn some good stuff about hand care. So thank you so much,
Savannah.
Dr. Gower.
All right. Take care, guys. Bye now.
Thank you very
Bye,
much.
Thank you so much.
Thank you.